In July 2019, a team from the Duke University Health System and Duke University School of Medicine traveled to Honduras to perform 11 heart valve surgeries for patients who did not have the means to pay for the surgery.
Did you guys want the CT?
CTA. Another CT?
He already had a CT? No.
He would. Yes, we would like to get a CT if we can. If you can do a contrast, that would be nice.
Imagine your doctor telling you you need surgery to replace a heart valve. If you live in Honduras, once you get that diagnosis, the doctor will hand you a list of items you must provide for the surgery, like saline solution, sutures, gloves, an oxygenator, pain medication, and a heart valve.
Overnight remained hemodynamically stable. Had 2 episodes of emesis yesterday, resolved with Reglan, tolerating some liquids.
Por la noche estuvo hemodinámicamente estable, tuvo 2 episodios de mesis que resolvieron con metoclopramida.
The Honduras at Instituto Nacional Cardiopulmonar in Tegucigalpa hopes to create a self-sustaining program with Duke University's help.
Recognition or award, but they all made it possible, and without every single person, I don't think this would have gone smoothly like it did. So lots and lots of people to thank.
Kind of the work that we were able to do there with more limited resources, and people out there that really need our help, and to not forget about them.
And it was very exciting, I don't think just for me, but for the entire team to be able to go down and do something like this. And going into the operations, we were excited, and fortunately our surgeries went well and the patients felt better. At the end of the week, it was probably the most gratifying professional experience I've ever had, to be able to help 11 people with an operation that they would never receive without us being there was extremely rewarding for me.